So, in this story, we're going to talk about how fake news has essentially led to threats and accusations against healthcare officials and people who work within hospitals. So, coronavirus doctor's diary, they say I have blood on my hands. So, this is about, I think, it's this person here. She's an anesthesiologist, I think. It says somewhere down here, and so we'll just go through this article and we'll just discuss it. So within Bradford's Asian community, a few individuals are spreading fake news that non-white patients will be left to die in hospitals. And so if we go here to this article, which is linked in, so it says, Assalamu alaikum sister, please don't show my details. I work for BRI Hospital Trust. I'm begging all of the Ummati, the Muslim community, if you have any health conditions, please do not go to hospital. You will not come back alive from this trust. We have a signed declaration of confidentiality in regards to what happens within the trust. So please, any health issues, try to deal with it at home. Also, to all the Ummati, have your daily black seed oil, which will prevent all disease. So black seed oil is seen within Islam to have good curing properties. I'm not sure how medically accurate that is, scientifically speaking, but I think this was genuinely a Muslim person who sent this. I don't know if they work at the hospital, but yeah, so if we jump back to the original article, here it says that the isolation of patients within the hospital and community continues to spark fires of uncertainty. So and false rumours. This is happening in cities across the country, and Bradford is no exception. So there's a lot of Muslim people, I think, by the looks of things, spreading fake news. I'm ashamed. I really am ashamed of you guys, whoever's doing this. Sometimes it's claimed that the high death rate among black, Asian, and other ethnic minority patients is because they are being killed off by the very hospital staff meant to help them. So essentially, people are spreading stories that hospital staff are killing off ethnic minorities inside hospitals. And people are scared, people are believing this. And, if there was any sort of feeling in your mind that, if I go to hospital, I'm not going to make it out, as this person states here, then I would too. I would also be scared. I would. Genuinely, I would be. So for our Muslim clinicians to have their dedication and professionalism questioned as they're working long shifts in the COVID wards while fasting, which must be incredibly difficult, but one of my colleagues, consultant anesthesiast Fozia Hayat, has been telling me about a malicious and foolish message she recently got from a local scaremonger. It came after her husband tried to dispute a story about people going to hospital and dying needlessly. He said it was wrong and that his wife could vouch for the result, as she works in the infirmary's intensive care unit, the ICU, and that's this links into this story here. So obviously I'll link both below as I do. So Professor Wright, a doctor and epistemologist, is head of the Bradford Institute for Health and Research and a veteran of cholera, HIV, Ebola epidemics in sub-Saharan Africa. He's writing this diary for BBC News and radio. So it goes on. So continuing from the anesthesiologist's point, at this point Fozia started getting sent videos, most of which she didn't open, but there was one she did watch, and she posted a brief reply. I essentially replied to say, just be careful what you share and look at both sides of the argument. It's important to ensure that you've got all the information, as you might cause harm, and you might stop somebody coming into hospital. And that's a really good and articulate point that she made, and that, look, people are sharing information without realising it. That's sometimes fake news. There's a Kistama story I'll talk about where he's been a victim of fake news recently, a doctored video. And so the point that she's making is, look, you're effectively stopping people going into hospital when they otherwise should go into hospital. So the message accused doctors of forcing people to sign do not resuscitate forms. And look, if the accusation is doctors are forcing people to sign do not resuscitate forms, then these forms have to exist. You realise how stupid this argument is, that if you're forcing someone to sign a do not resuscitate form, you would see these en masse, first of all, and then doctors will have to prove these forms exist in order for a family member not to be resuscitated. Otherwise, there will be inquiries into this. That's how stupid some of these people are that are sharing these stories. Then it said, please stop selling out and being... So this is where it gets worse. So this is another message. So it goes, please stop... It's important to say about there's do not resuscitate forms. It also suggested that coronavirus didn't actually exist. So this person went on to say, this person making the accusation, the stupid person, please stop selling out and being a mushroom and stand up for the truth. You'll be held responsible in the court of Allah and for the deaths of these people for negligence in this life. And this life is very short. So that using religion to effectively try and bully this person. So Fuzia looked up the message of the meaning of mushroom and on the internet and discovered it was someone who kept in the dark and fed false information. Sounds like this dude or whoever this person is a mushroom. So this is the month of Ramadan. We fast for in our families. We are practicing, and it was quite hard to have somebody send me a message saying you're a sellout, you're corrupt, a mushroom, you've got blood on your hands. That must be the most painful one. You've got blood on your hands. She is also surprised it was sent by somebody who runs a successful business. So yeah, a business owner, someone who's successful within the community, is sending her these messages. They seem like a fairly sensible person, but it makes it even more worrying. And some people, they can be smart when it comes to business, but dumb when it comes to other things. Hashtag Trump. Actually, he's dumb when it comes to business. It's fine to have an opinion. Don't be cruel. Don't accuse people of things. It's Ramadan. It's meant to be a time to be kind and generous to each other. Our concern is that one or two scaremongers are influencing our patients to stay away from hospitals. We know from, so this is her still talking, we know from our own data that hospital outcomes for white and South Asian patients are equally good, but careless talk will cost lives. So they might be good now, but these people spreading fake news might be stopping people who should go to the hospital from going to the hospital and effectively dying at home or suffering at home needlessly. When they could get help in a hospital. We also know that overall, looking at national and international data, Black and South Asian patients are at greater risk from dying from COVID-19. So it's imperative that they seek care without delay. And she's saying that, look, if you're ill and you need to go to the hospital, go to the hospital and get help. Fozia reported that the offensive message to the police, they were sympathetic, but she decided not to take it further. I wish she had taken it further, but obviously she would have her own reasons, not just because maybe she's the one the situation to escalate, or maybe because this guy's got money and he might go after her more aggressively. So instead, she's going to talk about it on Radio Ramadan at the suggestion of Sulfi Karim, head of the Bradford Council Mosques, and she will reassure people that if they are sick, they will be looked after in hospital regardless of their creed and colour, which is rightfully so, which is of course the truth. So when I put Sulfi and Fawzi in touch, he was disturbed by what she had been through at a time when she'd been working hard to save lives, and she said that she was determined to tackle false rumours, people doing 12-hour shifts and having to go home or go on their phone and suffer abuse. Come on. We can investigate where it's coming from, perhaps speak to some of those people involved. So much work is going on in the community, educate and inform, and it's really sad that this is happening, and it's very worrying, he said. I think we need to deal with urgent issues, and we need to react to messages to make sure we keep people coming to the hospital. And so, I don't know who these people are. I live in Northampton, nowhere near Bradford, but whoever you are, if you do stumble onto this video, stop spreading fake news, especially when it's a pandemic, especially when people are dying because of it. Grow up. Like, comment, subscribe, and hopefully I'll see you in the next one.